Today, we will talk about malaria, a common protozoan infectious diseases. Malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects a certain type of a mosquito which feeds on humans. People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illness. There are four types of malaria. First is the Plasmodium falciparum. Second is the Plasmodium vivax. Third is the Plasmodium ovale. And lastly, Plasmodium knowlesi. In 2020, there were an estimated 241 million cases of malaria worldwide. The estimated number of malaria deaths stood at 627,000 in 2020. The Philippines has also significantly reduced the incidence of malaria by 87% from 48,569 in 2003 to 6,120 cases in 2020, and also reported a 98% reduction in the number of mortality due to malaria, from 162 deaths in 2003 to 3 deaths in 2020. Characteristics and classification of malaria. Malaria is a serious relapsing infection in humans, characterized by periodic attacks of chills and fever, anemia, splenomegaly or enlargement of the spleen, and often fatal complications. It is caused by one-celled parasites of the genus Plasmodium that are transmitted to humans by the bite of Anopheles mosquitoes. Malaria is usually classified as asymptomatic, uncomplicated, or severe. Asymptomatic malaria can be caused by all Plasmodium species. The patient has circulating parasites but no symptoms. Uncomplicated malaria can be caused by all Plasmodium species, and symptoms generally occur 7 to 10 days after the initial mosquito bite. Host or host range. Plasmodium parasites' primary host and transmission vectors are female Anopheles mosquitoes. Human and other vertebrates are secondary hosts. The mosquitoes first take in the parasite by feeding on the blood of an infected person. Malaria parasites infect a wide range of vertebrate hosts such as reptiles, birds, and mammals. Examples are primates, ungulates, bats, and rodents. The next one is the pathogenesis. All the manifestations of malarial illness are caused by the infection of the red blood cells by the asexual forms of the malaria parasite, and the involvement of the red cells makes malaria a potentially multi-system disease. As every organ of the body is reached by the blood, severe malaria is predominantly caused by Plasmodium falciparum because of its ability to induce infected red blood cell or RBC.
Now let's talk
to
about the
adherence to the
symptoms,
vascular
prevention,
endothelium,
control, and the treatment of the disease. Symptoms of malaria include fever and flu-like illness, including shaking chills, headache, muscle aches, and tiredness. Nausea, vomiting, and diarrhea may also occur. Malaria may cause anemia and jaundice, yellow coloring of the skin and eyes, because of the loss of the red blood cells. The main current measures are focused on reduction of the contact between mosquitoes and humans, the destruction of larvae by environmental management, and the use of larvicides or mosquito larvae predators, and destruction of adult mosquitoes by indoor residual spraying and insecticide-treated bed nets. Malaria can be cured with prescription drugs. The type of drugs and length of treatment depend on the type of malaria where the person was infected, their age, whether they are pregnant, and how sick they are at the start of treatment. The new drug, Crintafel or Tafenoquine, prevents relapse of malaria caused by Plasmodium vivax or P. vivax, one of several parasites that causes the disease. Currently, patients with P. vivax or Plasmodium vivax require a 10-day treatment and many don't complete the regimen, leading to malaria recurrence. Doxycycline is an antibiotic that also can be used to prevent malaria. It is available in the United States by prescription only. It is sold under multiple brand names and it is also sold as a generic medicine. The most common anti-malaria drugs include chloroquine phosphate. Chloroquine phosphate is the preferred treatment for any parasite that is sensitive to the drug. The second is the artemisinin-based combination therapies or ACTs. It is a combination of two or more drugs that work against the malaria parasite in different ways.
Recommendation or conclusion. The outlook for malaria control is grim. The disease caused by mosquito-borne parasites is present in 102 countries and is responsible for over 100 million clinical cases and 1 to 2 million deaths each year. Over the past 2 decades, efforts to control malaria have met with less and less success. Malaria is a disease caused by a parasite. The parasite is spread to humans through the bites of infected mosquitoes. People who have malaria usually feel very sick with a high fever and shaking chills. While the disease is uncommon in temperate climates, malaria is still common in tropical and subtropical countries.